Absolutely, without question. I think it's helped my knees a lot.
Oh yeah, almost immediate pain relief. My name's Kevin Lamar. I'm 57 years old. My history is I played a lot of athletics in the past, primarily football, and I've had a number of knee surgeries. I've torn both of my quad tendons, and then I've also had cartilage surgery where I've had torn cartilage, and then I had a medial collateral surgery on my right knee. I feel pain on and off all the time. I was taking at least 8 Advil a day, and then they put me on medical grade ibuprofen, which was 800 milligrams a day, and a leave on top of that. And the more active I got, the more I had to take anti-inflammatories to deal with the pain. So I've tried just about everything short of getting knee replacements, and I'm trying. My depth is about right there.
Okay.
And that's when I started having pain. I was introduced to the Halo probably about 8 months ago. I actually lift the kneecap up a little bit, creating space. And that actually, when I do that, creates a sense of relief. I feel the difference right away. And I have reduced significantly my need for anti-inflammatories. I haven't had an anti-inflammatory in 2 weeks, and then I come back to this, okay.
You do that, you can actually feel the kneecap moving, and I'll kind of loosen the kneecap from that perspective. And then I'll pull up and just hold it for a little bit.
I can already feel my leg just, almost relax a little bit there.
The way I know that I've gotten a good workout is you get the nice red mark from the suction.
Oh yeah, almost immediate pain relief. Okay.
Now after that,
probably gotten a few more degrees. So, and it didn't really hurt as much when I went down, as much as that's. I put it on 2 minutes, and I've got without question. I think it's helped my knees a lot. And it's just a thing where I'll get up and I would have had pain before, and I'll get up and I'll go, oh, that didn't hurt. And I've introduced a lot with the Halo is I've gotten back into running, primarily on a treadmill, but I do some where I'll go to a local track and run. I can be more gradual. I'm up to about 3 miles. Like my knee is nowhere near as tight and doesn't swell as much after a workout session. Kind of funny because it's the simplest of things that I've noticed the most dramatic effect. What I have noticed is I can go downstairs and come upstairs and be sitting at my desk a little bit, use the Halo, and then get back up from my desk and go downstairs and upstairs. The pain going down has decreased significantly right after I do a section with my Halo. It seems like I said, I try to use it at least 3 times a day, morning, night, and sometime during the day.
Okay.
It seems I can get a better grip, and it seems like I can manipulate my kneecap further with this handle. I think it's because of the suction and probably because of the grip. What I didn't want to do is, okay, am I making this too loose? And he thought it was great. He was the one that was telling me about the manual manipulation. I actually take it with me when I travel as well too, so I try to exercise on the road. Without question. I think it's helped my knees a lot. It's easier for me to spend 2 minutes with the Halo to help address some of the inflammation and stuff than to have to get an ice pack out and wait for 15 minutes for it to have its effect. And oh yeah, almost immediate pain. It is. I really like it.
Good.